The Caribbean, I want you to start by telling me a little bit about the Association of Caribbean States. The Caribbean is a term that means different things to different people, but your organization covers something like 25 independent Caribbean countries and around 10 non-independent territories, which must make it one of the most expansive conceptions of the Caribbean there is. So maybe we can start by you telling us a bit about what your organization does and in the region.
Thank you very much for your warm welcome. I have to tell you that it is time for me to stop breaking barriers. It's very hard work, but it's something that I have thoroughly enjoyed, and the ACS is one of those areas where I am having such a good time because I am seeing what the Caribbean really means at the ACS. Here we have 25 members, as you said, and 10 associate members. And we have a group called Observer Organizations, as well as Observer Founding Members. And also we have Observer members from just about every continent, except Australia. And so we have a group, a very eclectic group of countries where we have the biggest democracy, which is Mexico. And we have the smallest democracy, which is St. Kitts and Nevis, coming together to manage certain mandates given to us by the heads of government. When we were formed in 1994, out of a long consultative process amongst ourselves in CARICOM and with the Central and other Latin American countries that border the Caribbean Sea, we decided that we had to concentrate on coordination and cooperation. So we do not duplicate what other regional organizations do. What our role is to ensure that whatever we do around the Greater Caribbean is properly coordinated. So we have to take actions to ensure that happens. And we have to do it in specific areas. These are disaster risk reduction, sustainable tourism, trade, transport, and anything to do with the Caribbean Sea. So our concept of the Caribbean is really what we call the Greater Caribbean. And we do all of our work in 3 languages, English, Spanish, and French. Whenever we have meetings, unless otherwise stated, we do our meetings in 3 languages, our documents are prepared in 3 languages, etc. So we have that reach of all of the countries around the Caribbean Sea, and all of these countries are eligible to participate from our convention in the ACS. So we have groupings, we do it by groupings. So we have the CARICOM group, the English-speaking Caribbean group. Then we have the Central American group. And both of these groups have their own secretariat. So there's a CARICOM secretariat, and for Central America, we have SECA. And then we have a group called the Big Three, which consists of Colombia, Venezuela, and Mexico. And we have another group that don't belong to any of these groups called the non-group, and that is Cuba, the Dominican Republic, and Panama. Then we have the associates. We have 10 of these. We brought in the British Virgin Islands for the first time last year. They're the first English speaking. And then we have the French speaking, and we have the Dutch speaking Antilles also within within our borders of the Greater Caribbean. And we manage anything, as I said, to do with the Caribbean Sea. So we advocate on behalf of the Caribbean Sea at the level of the United Nations. So that body of water, that lake, really is our focus as a Greater Caribbean.
You know, you have a very diverse group of countries.
Yes, we do.
And can you give us an idea of how the coronavirus has affected these countries?
Well, our countries have been affected in different ways because, as you said, we have a very diverse group. So the countries that are islands, small island developing states like the CARICOM countries have had to manage through CARICOM what they do. So they have had heads of government meetings. They have had meetings with their public health officials. And so they have been managing at that level. And the same thing for the Central American group. They are managing as a group. So they are putting in place all of the international protocols as is CARICOM, but they're doing it as groups. So you will see in the media things from CARICOM, or you'll see things from SICA. But the others, since they're not in a group, you will see individual statements coming from our other membership. And so we have a range of impacts on our regions, depending on where you are. It would seem that for islands, in the islands, not only CARICOM, because I consider the Dominican Republic, Haiti, Cuba, and so on within the island chain, it seems that the Dominican Republic is the most affected. And that is understandable. It is a big tourist economy. And so you would expect that because most of us were affected from outside and not from inside, that it was brought to the country. And so they have the biggest group. And with our other members, the biggest impact is on Mexico. But impact also depends on resources. Mm-hmm. So if you have 7 or 8 people in a population of, let's say, 40,000, that's a big number compared to a population of a million, 128 million, 28 million, etc. But it has impacted all of us, every single one of us, on our resources, and it is having a devastating impact on our economies, because a lot of our economies had to close down for governments to put in place the proper protocols to save lives. And let me say that I am so proud of the approaches of all of our governments in the Greater Caribbean, because they have done all of the things that they were supposed to do, and they did it in a very timely manner. So to a large extent, we have been able to contain, and you don't see widespread outbreak into communities. And then also we have had a lot of recoveries. A lot of our countries are talking about recovery, and
as in health.
So yes,
right, from the virus.
Yes. So not many of our countries have had a lot of deaths. In some countries we have had 1. In other countries we have had 5 out of all of those who were tested. In the biggest ones, as I said, are in the countries where you see the most cases.
Could that just be a lag time, though, that it's still very early in the spread to the region?
It is early, but some of our countries are doing, because some of us have water as our border, and we have closed our ports, it is easier to manage because you don't have any more coming in. But we do have a challenge with testing, because we have not all of us have all of the kits we have to do the entire population. And so the random testing is going on, but countries are also already, because of the way that it's going, are already speaking about reopening them, within the country.
But isn't that going very much against the very point you made that an island can be closed off? Whereas, which you suggested is one of the reasons why the spread hasn't been that great yet. But if you reopen, then, islands are very open, very porous places. most of our food or supplies come in, even if the tourism industry remains closed, we still need food supplies, you know, capital products and so on.
Yes,
Capital.
yes, I agree with you. But when I said open, they're starting to reopen, I mean that they're letting us out of our homes now.
Oh,
I don't mean that they're opening borders.
open.
I don't mean that they're opening borders. That
Right.
will take a little longer to happen.
But
But
that is
and they do have protocols in place with regard to food supply and ports opening. So it's trade is affected obviously, and so is food coming into the country. But remember, I also have other regions that have land borders,
mm-hmm.
and these are also taking precautions with regard to their borders. So
That would be more challenging. I mean, it would be more challenging to control border movement within the group.
it is more challenging, but all of these countries have put in place proper protocols in that regard. So you are not seeing widespread community infection as you would probably have seen before if they had not taken the steps to protect their borders. But
Oh,
border protection have other issues that we can talk about. So,
sure. Would you like to point out some of those?
well, one of the challenges for border protection when you have a land border must be migrants and refugees, and it is one of the issues that the IOM,
Mm-hmm.
the National International Organization on Migration and Refugees and so on, is looking at very closely,
Mm-hmm.
because we had challenges before in some of our countries with regard to migration, but everyone is trying to ensure that human rights are protected as they do these things, and they're also trying to open their borders or keep borders in certain areas open so that the people who are in shelters on these borders can have access to shelter and to food, etc. So it is difficult. It's difficult in good times, far less in bad times. But I think our countries are making a genuine effort to ensure that these things continue to happen.
Who would you say are the vulnerable populations that populations are more affected by?
Well, we have identified a group at the level of the ACS, and we do have a listing. We have women, we have children and teenagers, we have indigenous people, we have migrants and refugees, we have the elderly, we have the disabled people, we have people with mental challenges, and we have a very interesting group that we have not put in as a vulnerable group, but we need to look at very closely, and that's the urban poor, as opposed to the people who are generally considered poor, because the rural poor will have challenges, but they may have access to food, even if they don't have access to land. But the urban poor, where most of the informal sector lives, is a big challenge for governments, because the informal sector has shut down with the closure and the stay-at-home orders. So these are people who are considered within the vulnerable groups. And these are the people that our governments, even without social protection programs, are trying to ensure they provide for through their fiscal packages and their food packages, etc. So governments are forced now to look at how they can now feed these people who are especially in the urban areas and who don't have a job and who will not have a job for a very long time. So these are some of the people that we look at as the vulnerable.
Do you think that governments really have the resources to support the large numbers of people out of work, the insecure population, especially the migrant populations? I mean, you know, as you said, there are different internal conditions that make vulnerability look very different across the different countries. For example, the large numbers of internally displaced people in El Salvador and Honduras, migrant workers in the Caribbean
The Caribbean.
who are still being courted by the US and Canada to work, who are suddenly part of the essential workers categories, but whose governments allegedly have said, we're not responsible if you get sick. I mean, how is the region protecting its people in these situations?
It will be very difficult. They can only do it in the short term, and they will have to find resources to do it in the medium and the long term. But I think there's opportunity for putting in place the proper measures for dealing with vulnerable groups in the long term. A lot of the challenges that we face, if we do not address them now as we are dealing with the crisis and managing them properly, they will be problems that we will not be able to manage after the crisis. So each of our regions is approaching it according to the resources that they have. So for example, the Central American region has gone to their financial institutions. They have a very good system of crisis management that they have been able to mobilize. And because they have been able to mobilize their banks, their development banks, their private sector, you are seeing a lot of funding going into social protection programs and social development at this time. We have seen a similar thing with CARICOM countries, but again, as I said, CARICOM countries may only be able to do that in the short term, and we have to assist them in doing it in the medium and long term. And I say we, because I don't see this as a small island developing state challenge. First of all, it is a challenge for our entire region. These are the reasons why South-South cooperation must become a reality. We have been talking about South-South cooperation for a long time. We have been talking about the ACS as a group that can work together and coordinate together. This is where it is happening now. So I am seeing opportunity for deepening integration in the region to ensure that all of our member states, because if it affects Trinidad and Tobago, it affects Colombia, it affects Panama because of the movement of people. And if we do not approach it from a regional perspective, then we will be left behind. And so our governments have recognized that. So we have a number of regional things happening right now that you did not see maybe 6 months ago. And that is where I see the hope. That is where I see the hope. So
it would be great if you could elaborate on some of these, because I mean, the challenge that we're all facing is that everybody's going through an economically hard time now, you know, not just within the region, but globally. And the question is what are the ways in which we can help one another when our economies are crashing? So what are some of the initiatives that governments are taking?
I can see, let me give you, my two best experiences are the regional bodies like SECA and CARICOM. So you can see with SECA, as I said, they had a crisis management plan. And that plan was a regional plan. So it covers all of their membership. And so the Central American Development Bank was called into action immediately. And that bank has been able to give each of its member states a certain amount of financing, has been able to help members to source and to get medications and medical supplies at a much lower rate because they do it as a group. So you can see all of these things coming together. They have been able to meet with all, I mean, governance of this thing is very important. All of the presidents have met and have said, this is the approach. At this time, leadership is very, very important, how you manage this COVID. So the leaders in Central America have met and said, this is the approach we are going to take. This is what we are going to do. And they have already started planning for recovery by engaging with the Development Bank and other banks with regard to grants for small and medium enterprises to help them to recover very quickly. So they are putting that plan in place. Similarly, with the CARICOM region, the governments have met and they have had a series of meetings where they have looked at all of the various COVID protocols that they are putting in place. You will see that it is done on a very coordinated basis, and a lot of things that happens in one country, you will see it happening in the next country, and they phase these things according to the resources that they have. And they have all put in place support in the short term for people who are unemployed, for families that are considered poor, for vulnerable populations, even migrants, including sex workers, etc. They have put in place a number of protocols that will address all of these in the short term. But as you rightfully said, especially for the CARICOM region, the fiscal space is very small, is extremely small. And so we now have to dig deep into the integration bag to see how the other countries around the region can also help. And this morning I had a very, very interesting meeting with SECA, and we are looking to see how some of the things that they have put in place, especially funding, can now be extended to the rest of the Caribbean, because they have made it very clear that if it happens to Latin America, it happens to the Caribbean. And so we are starting to see that kind of cooperation and integration taking place. And I can tell you that it is a very positive move.
So if I can extrapolate from what you're saying, the ACS's role in this period is really to kind of bring these different groupings together and to try to find concrete ways to forge a kind of common way forward for countries that really don't have all that much, even though they're members of the ACS, all that much, intimate traffic in terms of economics and social relations.
Yes, we have, we are putting in place what we call practical integration. You said concrete, but we are putting practical things in place. We are looking at issues right now at the ACS to deal with new food sources, because our traditional ones will not be available. Let me tell you, we have a population within the ACS membership. We have something like 312 million people in the ACS alone. And we have access to 650 million in Latin America and the Caribbean. So we have never taken advantage of that. And this is the point where we are trying to do that. So we know, for example, that most of our economies depend on tourism. And our sources of tourism are the United States and Europe. And these two areas are very affected. So what will happen to our tourism product once our own countries start to recover? We must face Central and Latin America for us to be able to do that. Tourism will, and ourselves also, because tourism must be something that we reimagine at this point. We must reimagine what we can do. We have all of these markets that we have never taken advantage of, and they have never seen us either as places to visit. Yet we have on our agenda something called multi-destination tourism. So we need always to remember that if we deepen integration around the region, we have, at least in the short and medium term, avenues to be able to deal with some of the challenges that we're facing.
Is this one of the discussions that's taking place, how to reimagine tourism, not just in terms of being a multi-destination, putting in place a multi-destination approach, but what is the conversation around cruise ship tourism?
Right now,
yeah. As a big one, or are we expecting air travel to go back to the volumes that existed before?
It will take some time.
Mm-hmm.
It will take some time to recover. But I am saying, and I don't even know that the volumes that we had before will come back in a short time. It will take years. People will not be moving freely until there's a vaccine that everybody can freely take. And so, of course, that will be a problem. But I'm saying that we have other markets in the region that if they recover quickly, that we can start to work with them. And I can tell you that at the ACS, we have CTO as one of our founding observer organizations. So they come into our meetings, so we hear what they have to say.
Sorry, Caribbean Tourism Organization. Just wanted to say what CTO is.
And then we have the Central American Tourism Association, and we are having meetings with both of them and together for us to be able to coordinate these things in the long run. Nothing concrete has come out of it yet. We just started the conversations 2 weeks ago, but we have all recognized that we have to depend on each other with regard to tourism, with regard to food security and agriculture. One of the challenges for the region is that we will not be earning foreign exchange because we do not have tourism, and tourism is our biggest foreign exchange earner. And we have been grappling for years with diversification. But you know that agriculture in recent times has not brought in the kind of foreign exchange that we expect, and because of the prices of commodities on the global market. And so many people have moved into providing food for tourism. So the linkages that a lot of our farmers had with the hotels, all of that will be affected. But that can now go into to our own food security and how we deal with feeding ourselves at this point, and not just tourists or sending the food that we, whatever we exported before, we can now look at it for our own food security. And surprisingly, agriculture is one of the areas that governments are investing in presently. Everybody now has a backyard garden if they have access to land. And it's one of the protocols that they have put in place, feed yourself protocols. All of our countries have done that. And so we are starting to see that some of the things that we had given up in the name of just foreign exchange, we need to go back to. And some of the governments are, of course, having to reimagine their economies as they move forward after COVID. Lots of things that we have spoken about, Professor Lewis, in the past must come back on the table. Things like land reform, giving people access to land, so that they can have access to food, because that's really what it is, access to food, that you don't have to go and buy from somewhere that has been imported and so on. That people are looking at eat what you grow programs. So this is one of the things that we're doing, but we do not have a food shortage in the Greater Caribbean. Remember the countries that I told you that we have in the Greater Caribbean. Our challenge is, however, how do we get food from the big three, from Central America, from Mexico, etc., to take that food into the islands. Now, we have been having a lot of conversations in recent times with transport organizations, maritime organizations, port organizations from around the region. My Directorate of Trade and Sustainable Development have been having a series of meetings. What we need now is a meeting of the ministers who control trade and transport, for us to be able to see how we can bring food into the region. We have the Panama Canal right there, and it is within the Greater Caribbean. How do we use, because right now, trade and ships and shipping will become even more important for the Caribbean.
Okay, I just want to pause to invite members of our audience to please feel free to field questions using the question and answer button at the bottom of your screen. You know, you're welcome to jump in at any time. So are you saying that coming out of this period, you would expect to see a different approach beyond the neoliberal approach of open markets that we've been very much, you know, a part of and locked into, and seeing a different kind of economy and social relations? And what would be pushing that? Do you think that that would be sustained after, you know, there's a vaccine and life return to some semblance of normalcy?
If we do not use this opportunity to consolidate the things that we are going to gain in the short term, especially with regard to cooperation and integration, yes, I can see us going back to the old way of doing things. But I think that you are seeing now that many of our countries, and maybe individually at this time, but definitely as groups, are coming together to advocate on certain issues. So, for example, I was in a meeting with ECLAC and the finance ministers, and the Caribbean is saying that it has been taken advantage of in many ways by institutions. Maybe because, let's say, because of trade. So we were forced to open our borders, but we always knew it was not on an equal footing. I mean, how can you have equal footing when our economies are so small, our economies are so dependent, our economies are so vulnerable, and at the same time, you have other economies that are also not as open as ours and are bigger than ours, and still belong to the World Trade Organization. We will know that there have been subsidies for farmers in many countries that are not in the Caribbean, and yet we get punished all the time. And I say punished because whenever we are doing better and moving ourselves away from being low-income countries, they classify us as medium-income countries, and then they give us no access to concessionary financing. We have no access to grants. We have to take loans from international financial organizations at exorbitant rates. If we continue to do that, our economies will never recover, and we will never move towards equality in our region. One of the reasons for our inequity in Latin America and the Caribbean is has a second highest level of inequality in the world. If we do not tackle the 60% of people who will be underprivileged, who will be poor, because we had a great number of people who were just on the poverty line, the working poor. If we do not tackle this now in the short term, and we go back to the ways that we did things in the long term, our economies will never recover. I hate to sound so pessimistic. We have to now, in the short term, put in place things, take serious policy decisions that will ensure that in post-COVID, in a year, 2 years, whatever, that we concentrate on restructuring some of the things that we are doing. Relooking, rethinking, redesigning what are our markets, what are our food sources, whom do we integrate with, who helped us out? Basic question. Who came to our assistance during this time?
Okay, before I follow up on this one, I just want to remind you again that you are welcome to ask questions. We'd love to hear from you. And there's a question from Sonia Phillip. During this time of crisis, there is a greater inclination towards cooperation and concerted action. After this crisis passes, as it will, do you think that this willingness to work together and speak with one voice will continue? Is there anything that can be done to encourage a continuation of concerted action?
Well, that's the question I tried to answer just before the question came in.
Yeah.
We needed to be able to consolidate these things in the short term during the crisis so that we do not go back to a situation where regional integration and multilateralism is under attack.
Yeah.
We have to be sure that who we know, the people that we work with, we are afraid of people who speak a different language to us. You know, we are afraid of people who are our neighbors. This is where we have to draw the line. We have to draw the line, and we have to come up with regional strategies. And the ACS has worked on a regional strategy that we are circulating to our membership. We had a meeting, an extraordinary meeting of the Ministers of Foreign Affairs and the Ministers of Health, and we are working on a regional approach for the entire Greater Caribbean. We are also working on a regional resource mobilization plan, because right now we are facing challenges that we had faced before COVID and that will heighten during COVID. We have issues like de-risking. We had challenges in the first place with getting banks to facilitate our transactions. And our governments have gone high and low globally to ask for advocacy. But we have advocates right here around the Greater Caribbean who can help. We have people in the Greater Caribbean who can advocate for us in a number of fora where they belong, you know, and they can put our because we are not at many tables, and they can put our points of view and our reality on the table. We have to work on joint sectoral plans, whether it is with tourism or agriculture or with trade and so on. It means that our various private sectors must be involved. Right now, governments are the ones who are facilitating most of this, and private sector is assisting. I'm not saying they're not assisting, but we want to hear their voices more. And in the region, we have big private sectors in the Greater Caribbean. We want them more involved in helping to facilitate social and economic development. We also have the opportunity, if at this point we include communities and stakeholders in the discussion. They will never allow us to go back to the old way of doing things if we include the people on the ground. We are making policies now for vulnerable people as if vulnerable people don't have a voice. Yeah. They cannot speak on their own behalf. How are we engaging with them even now for us to be able to put in place proper policies so they would have buy-in, so that once we start to recover, we start to see a more people-centered approach to regional integration. And these are some of the things I'd like to see. So it will not be easy because we have a mindset. We have a mindset.
Okay, we have two questions here for Andre Blackburn. I think you answered his first question, which is, what are the main areas that the region should look at as we rebuild and recover from COVID-19? You could elaborate if you have other suggestions. But the second question is, how do we strike a balance between preparing for traditional hazards such as hurricanes and new hazards, particularly biological ones like COVID-19?
Well, I think that from now on, our development plans must be crisis management plans. And we have a lot of experience in the region in disaster risk reduction. We have all kinds of agencies dealing with disaster risk reduction in the Caribbean. This is a disaster. This is a disaster, and our approach to it must be the same as we have done for all natural disasters that we have had, at least things that we have not been responsible for doing, not man-made things. Although I think that this is also because it's such an environmental, we have so degraded our environments that these pandemics will continue to happen and will continue to affect us. So we have to prepare for that. But I think this gives us the opportunity to put the proper things in place. And then when it happens, then we can mobilize. So for example, we deal with disaster risk reduction in the region. Let me take Central America again. We have CEPREDINAC, which is the center responsible for disaster risk reduction in Central America. We have SEDIMA, which is the Caribbean equivalent for disaster risk reduction. We have the ACS that's responsible for coordinating these things. We have a number of regional and international geospatial bodies that are involved in disaster risk reduction. The ACS itself, through the UN, we have trained people in GIS. And right after this interview, I have a meeting with the geospatial people for us to talk about data collection and statistics and how we put these things in place. We are moving in a very scientific way to look at it. The ACS, for example, has developed a dashboard, which we'll be rolling out to a technical meeting on Monday, that covers the entire Greater Caribbean. So you can, once we roll it out to the membership and then to the public, you'll be able to go in and see, for example, all of the COVID data. How many people in the region, how many people have recovered, how many people have died, what governments have put in place, what is the best practices. And we are using that tool to look at the gaps for us to know what we need to do in the future. And we are also using this tool for disaster risk reduction and planning for the future. So we'll be able to put in, and we are putting into the data, all the best practices around the region with regard to disaster risk reduction. We are looking at where shelters are located, what resources each of our countries have. We are having meetings with the humanitarian hub in Panama, with which we have an MOU to make sure that once the hurricane season starts in June, that we will be ready to respond to our countries if we have a serious hurricane. So we are putting a number of things in place to ensure that these things happen, including looking at finances for recovery as we move along. So you will see a lot of things rolling out in the next 2 weeks with regard to disaster risk reduction. You will also see it with regard to regional plans for the Greater Caribbean. And we are very proud of the work that all of our regions are doing right now to ensure that this happens.
I have a question here that basically is asking, what do you account for the vast difference in terms of infection rates between the DR and Haiti outside of tourism? So they understand that the DR is very much exposed because of the tourism industry, but they're asking, how do you explain Haiti not having the high numbers of infection?
I have a challenge generally with data, and because of the fact that resources are not the same in all of these countries. So we have not been able to test widely in some of these countries, and Haiti is one of those. So we are waiting to see when more random testing and mass testing is done, how these countries are affected. I don't think that anybody should look at the figures right now and say, and be proud, we only have 7 COVID cases, or we only have 8 COVID cases, or we have not had a case for 10 days. Because as people are tested, more and more numbers will come forward. The issue is how our system's going to respond to the increase in numbers, what protocols we will put in place to protect the citizens if we are already starting roll back to work programs, and how are we going to get these resources if we do not have them now? And again, all of these issues can be handled from a regional perspective.
Are there initiatives to draw on health systems and capacity across the region if this really gets bad? I have been seeing stories of really interesting initiatives with Cuban doctors being allowed to work in Brazil, of Venezuelan refugees or migrants who are healthcare workers being allowed to practice, their profession, which is something that goes in when people migrate, the ability to work in your profession, that are very hopeful signs. But in a very politically divided region. And I'm curious, looking at Venezuela, for example, and the kind of differences and some very, very emotional feelings around Venezuela. How are you managing to overcome that? So I've just asked you two different questions here.
I know. I'll go to the Venezuela question first because people always ask me about Venezuela. Under ACS, we have members. And one of the things that we do is cooperation and coordination. Mm-hmm. And the political issues, while we deal with, because we have heads of government and we have ministers of foreign affairs dealing with these things, mm-hmm. They do not impact as much as people would like to believe. Okay. Because we have, for example, we get contributions from all of our member states that we use for all of our work. And no one has said to any one of us at the ACS that Venezuela or Cuba are not members of this organization. We have not had that in the ACS. And I'm very proud that we have been able to weather some of these attacks that other multilateral organizations have had to face. So that's how I'm going to deal with the Venezuela issue. With regard to the Cubans, you know that the Cuban footprint is very big in the Greater Caribbean. Cuba has been working with us, not only with regard to resources for our member states, but also with regard to resources for our associate members, because there are some of our associates that do not get any funding from the country to which they are tied. So if we are doing regional programs, we make sure that they also benefit from these regional programs. And one of them is in capacity building. We have a technical meeting, for example, on Monday, where Cuba is going to do some technical work with some of our people on COVID-19. We have just requested to be in the Central American capacity building workshops that they are having so that everyone of us around the Greater Caribbean would benefit from this. So it's a very positive sign. And more than that, as you said, governments that you would not expect to be making use of the skills and professional talents of migrants are now giving them the opportunity. So we are also seeing, apart from the xenophobia, the racism that normally happens, we are seeing now that we are not just seeing migrants as people who come to take from the countries. You know, this is the region in the world where migration has affected us the most positively. I'm a historian, you know that. And migration has always been how we better ourselves in the Caribbean. It has always been. So no matter where we go, you can find a St. Lucian community in Panama, or you can find a St. Lucian community in Brazil, or you can find a Barbadian community in Panama, or in a very interesting place like Nicaragua. And so we have always migrated and contributed to the development of societies. And I think that we have to start rethinking what we thought about migrants before. Many migrants come with a lot of skills, and not only agricultural skills. They are not just people you put in a field to work. And in the Caribbean, we have always been able to work with migrants. I remember being responsible for diaspora affairs in St. Lucia and dealing with various diasporas in St. Lucia. So I would meet with the Jamaican Diaspora Association of St. Lucia. You know, so we have always done that. And some of our countries have always taken the view that as long as migrants are coming to our countries to contribute, then we will integrate them.
Okay.
The Cubans, sorry.
No, you can Just finish
I
this.
was saying that the Cuban doctors have worked in all of our countries, no matter our ideology, and it will continue.
Okay. You mentioned the non-independent territories, and France and the Netherlands are observed or represented on the ACS on behalf of their territories. How are they engaging with the region? That's one question. And I want to get in the other question before we finish, which is more related to who are our friends and where does the US fit in all of this? I mean, what's the US's role? What has been its relationship to the region in this period?
And with regard to, what was the first one again? I didn't write it down.
Okay, you can start at the Dutch and the European powers that are in the Caribbean and in
speak on behalf, they speak on behalf of certain territories.
Mm-hmm.
So for example, within our organization, Martinique and Guadeloupe can speak on for themselves.
Okay.
France does not speak for them. And the French are engaging with their membership at this time to try to roll out some kind of program to them. We are not sure what that program will look like yet, as well as the Netherlands. Up to yesterday, the Netherlands were not too sure what kind of financial program they're going to roll out. But they are going to roll out a program to them. On the other hand, the British has not, which is not in our organization, but the British Virgin Islands is in our organization, has indicated that they are not included in the British COVID plan. So they have to do it on their own. So some of our countries will get support, but other countries will not get support. And so we have to ensure, and even the support that some of the countries will get, because so for example, France has approved for Martinique to get Cuban doctors. Some of the support will not come from these countries. They will come from our region also. And so our region will have to ensure that we do what we can within the ACS for them. With regard to the United States, we at the ACS, we do not engage with the United States directly. The US Virgin Islands is eligible to be an associate of the organization, as is Puerto Rico, but they have not engaged with us. I'm always reminded that of Errol Barrow's statement that we are friends of all and satellites of none, and I always take that approach. So whoever wants to approach us in that way, we will work with them. We work with the Europeans. We work with the Latin Americans. We would be very happy to work with the Americans. We do it indirectly through our relationships with the OAS and with organizations like the UN, etc. But they do not engage with the ACS directly because the territories are not our associates.
Okay. I have a question here, which I'm not quite sure I understand, but it's basically asking, to what extent do the institutional frameworks and aid modalities support the achievement of expected regional strategy results? I think it's the second part I'm not quite sure about.
Read it again.
To what extent do the institutional frameworks and aid modalities support the achievement of expected regional strategy results? I'm not quite sure about the regional strategy results. I'm not quite sure what.
We also do not work with these financial institutions. So it's a very hard question for me to understand and to respond to. But we do work with other organizations that work with them, and so we are able to benefit in that regard. But all of these international financial institutions have an impact on what we do in the region. And how our governments, because we don't deal with them, we are not a government, how our governments approach them together will be a very important issue with regard to what will emerge after COVID, because some of our countries are saying, I'm reading the news, and some of our countries are saying they are not going to the IMF for loans. Some of them are going, or saying they might go. You know, what are these? What will be the conditions for these loans? How will they affect the structure of our organizations afterwards? These are all things that I think that governments are grappling with right now. And I think that if all of us speak to these issues and speak to what the governments have indicated that they want and how they want us to advocate, then we will be able to have a regional approach that ensures that our countries emerge as different countries after COVID, countries that are looking towards each other and towards the rest of the region for recovery and resilience building.
Okay, thanks for that question, Captain Nicholas. We have 3 minutes left.
Yes, we do, because I have another meeting.
Right. Did you want to say anything?
No, let's take the last question, and we can move from there.
Okay. Oh, there is a last question. Oh, Kathy says thank you. You answered his question. So, do you feel like we'll be coming out of this pandemic in a more hopeful place for the region, with a more divided region? Or, I mean, you know, I think we've been focusing a lot on the positives, but, you know, what are some of the challenges do you see?
We have a number of challenges. Some of them are financial. As I said, we have the issue of graduation, the issue of de-risking. We have the social challenges that we spoke to already. But these challenges all find solutions in integration and regional integration. Yeah. I have spent my entire life at the regional level, and I remain a positive person because I have seen the gains that we have made, and I have seen the possibilities of regional integration. And I think that I am even more excited after I had a meeting today with SICA and some of the things that we are going to put in place in the next few weeks. So I am saying that I am seeing a more integrated region, and I would put it out there to all of those people in charge of governance in the region, that integration, cooperation, and coordination will take us to a new level of social and economic development that we must embrace in the short term, in the medium term, and in the long term.
Well, on that note, a very powerful note on which to end. Thank you so much, Dr. Soomer. It was really wonderful conversation.
Thank you very much, and thanks to all those who participated.